Hello, everyone. It's Dr. Rachel Brown, Medical Director of Prevention and Wellness with Business Health Solutions at Prisma Health. And this is our monthly COVID and Wellness update. Happy New Year to everyone. Fingers crossed that 2022 is the best year ever. We're not getting a great start. Everyone understands probably at this point that we are involved in yet another COVID surge, this one caused by the variant Omicron, which we're going to talk about in just a moment. But I do want to share my screen and let you all see exactly what DHEC is reporting in terms of numbers. So when you go to the DHEC county level page, first of all, you're going to see right away that we're all back in that high incidence category. So every county is at high incidence, which means everyone should be masking and socially distancing. What's most striking is over here. So here's the surge that we felt the summer of 2020 after quarantine was released and everybody was excited to get back to July 4th parties. Little blip there. We thought that was a big deal. Then we had the surge right around the holidays into 2021 because of all the social gatherings. That kind of got us, didn't it? And then we had the Delta surge, which was significant in that not only did we have an increase in numbers of folks who were sick, despite having folks who were vaccinated. So all of those infections, or the majority of those infections, were among the unvaccinated. But there was a very severe surge, sending lots and lots of people to the hospital and in the ICUs. Now look at the current surge that we're in. Look at this spike, unlike anything we have seen before. And that is because Omicron is highly, highly contagious, much more contagious than the original strain of COVID, subsequent variants, and even more contagious than the Delta variant. The good news here might be that when you look at the data from South Africa and other European countries that have gotten through their Omicron surge, they see these tremendous, nightmarish spikes, huge numbers of people getting this infection, but then it comes down very, very quickly. And that may be in part to the characteristics of the virus. It may be due in part to the fact that it is so contagious. It just sweeps through communities, develops herd immunity, and moves on. So we're hoping that this surge does not last too long. Unfortunately, it occurred right over the holidays, which means that we might see a little bit of a different trend than the other countries are seeing, because we did have lots of social gatherings and lots of folks not necessarily masking. All right, one of the scariest things, and that's certainly indicated by this number here, is that percent positive that we've been watching for the past 2 years and that I've been reporting out to you. And in general, to feel comfortable that we have a pandemic under control in our own community, we want that percent positive to be less than 5%. This may be an indirect measure, but it certainly is one that we can follow the trend to get a sense of the prevalence of COVID in our communities and our state. Currently, the 7-week average for our percent positive is 27%, which means more than a quarter of folks who are getting tested actually have COVID. And for the last couple of days, single day reported percent positives have been more along the 33 to 35%. So 1 out of 3 people. I can tell you at Prisma Health, in our outpatient settings, people who present for testing, usually with symptoms, almost 50% of those folks are testing positive. So if you hadn't noticed it just from looking around at family, friends, colleagues, this one is getting everybody. The numbers are out of control. The good news, though, is that while, of course, because more people are infected, we're going to see more people in the hospital, but the rate of rise of hospitalization and admission to an intensive care unit, ventilation, and even death with Omicron seems to not be as significant as with Delta. So while this particular strain is highly contagious, highly infectious, almost everyone knows of at least a dozen people who have it, or they have had it themselves. It does seem that it may not be as severe. Now, unfortunately, we can't always predict who's going to have a severe case and who is not. Certainly our folks who are immunocompromised, our elderly are at higher risk. We have identified risk factors for COVID, such as smoking, obesity, chronic diseases such as diabetes, hypertension, stroke, that may lead to worse consequences. But we've also seen worse consequences happen in folks who don't have those risk factors. So it's still important to try to avoid this. If you or your workforce are treating this like the flu or some other respiratory kind of seasonal cold, that's not going to be enough. There will be folks who will get severe infections. You will have outbreaks in your workforce and lose your productivity. We need to still tend to this pandemic in the way that you tend to a pandemic, and that is to test, to quarantine and isolate, to mask, and to socially distance. Things we've been talking about for 2 years. So let's move on. We talked about Omicron. I want to go over with you the quarantine and isolation recommendations that have been updated from CDC and DHEC. We're also going to talk about different types of testing and the options that are in our community and state. We're going to review some of the updates to some of the vaccine recommendations as well. And I just want to touch on treatment for a second and how that may apply to your workforce. And then we're going to end by talking about the OSHA ETS and where we are there. All right, so let me share another screen with you. About a week or so ago, maybe a little bit longer than that, CDC recommended some new guidelines for managing folks who either may have been exposed to COVID or who have COVID. And this is going to significantly impact your policies. And so let's go through these with a fine-tooth comb so that you understand how to manage your employees. Anybody who tests positive for COVID. And I will tell you that we really are encouraging folks who have symptoms to get tested. When we talk with our infectious disease and laboratory specialists at the hospital and other healthcare systems, we are seeing predominantly COVID as a cause of respiratory symptoms. This is respiratory disease season, and so there is flu, and there are colds, and there are RSV infections. But most of what we're seeing now is COVID. So we're really trying to encourage folks not to blow off symptoms and to get tested. We understand that's difficult, and we're going to talk about testing in just a second. All right, so anyone who tests positive, or excuse me, who has symptoms, you're going to want to encourage right away to seek some sort of care and get tested. If they test positive, it does not matter, and it never has mattered, what their vaccination status is, okay? Everyone who tests positive needs to isolate, meaning go home and avoid everyone. Not just avoid work, but avoid everyone, and even try to avoid other household members if that's at all possible. The change is that instead of quarantining for 10 days or 14 days or even 7 days, or a negative test on 7 days and come back if it's negative, they are recommending that folks can isolate for 5 days, and if their symptoms are significantly improving, meaning almost gone, and they have been fever-free for 24 hours, they can come back to work at day 5 and continue, hopefully, but certainly make sure they're wearing a mask for an additional 5 days. You may even go a step further and make sure they're isolated from colleagues and other co-workers, but they can come back at day 5 if they haven't had a fever for 24 hours without the use of a fever reducing agent like acetaminophen or ibuprofen, and their symptoms are significantly improved. That can be a tough one, I get it. Someone may still feel very fatigued. Someone still may have congestion or cough, but overall they need to be feeling significantly better before they come back. And even then they need to wear a mask for 5 days. Please do not bring someone back to work who is still feverish or significantly symptomatic. And this is an oversimplified piece of advice, but it's easiest to think of this as more symptoms, more contagious, right? So the less symptoms someone has before you bring them back, the less you're going to put your workforce at risk for an outbreak. All right. Let's talk about folks who are exposed because that tends to be a little bit trickier a situation. All right. For folks who have gotten 2 mRNA vaccines plus their booster, or 1 Johnson & Johnson vaccine plus their booster, or they've gotten their mRNA vaccine series of 2 vaccines or their Johnson & Johnson vaccine, and it's not time for their booster yet. It's too early for them to get their booster. They do not have to quarantine or isolate themselves from other people once they have been exposed, if they've had an exposure. They do need to wear their mask for 10 days. So if you've noticed that your workforce is getting a little lax on the masking policy, I encourage you to reinvigorate that for everyone, but certainly for those folks who've been exposed to COVID, they need to wear their mask for 10 days. There's an option to test at day 5. Give them a little time to see if there's an infection, see if symptoms develop. You can test at day 5. If that's negative, you can feel even more comfortable that they are not going to pass on this infection, okay? But it's important that you understand this is only for folks who are at the height of their immunity, meaning they have gotten the series of vaccines and been boosted, or that 5 to 6 months has not gone by after their vaccine series when they're due for their booster. Okay, so these are the folks who have the most robust immunity. They do not have to quarantine. What's different and what may impact your workforce pretty significantly is those folks who are considered fully vaccinated, meaning they got 1 dose of the J&J or 2 doses of the Pfizer or Moderna mRNA vaccines, but they did not get their booster. So they're 5 to 6 months out from having their vaccination series, or greater than 2 months out from having their Johnson & Johnson vaccine, and they have not yet been boosted. It is felt that especially against Omicron, these folks do not have optimal immunity and therefore can be infected and be infectious. And so these people do have to quarantine. This is different. Before, we felt that folks who had been fully vaccinated, meaning 2 doses of an mRNA vaccine or 1 of the Johnson & Johnson, did not need to quarantine if they were exposed. Now they do. They need to stay home for 5 days. If they are asymptomatic, they do not have any symptoms at that day 5 mark, they can come back to work and they can wear a mask for an additional 5 days. You also do have the option, it's not required, but the option to test at day 5 just to be sure. So to recap, no matter what the vaccination status is, if someone tests positive, they stay home, they isolate for 5 days, they come back only if they're fever-free for 24 hours without cheating and using medications to do that, and they're significantly improved in their symptoms, and they wear a mask for another 5 days or forever, right? Folks who have been boosted, or it's not time for their booster yet and they've completed a vaccination series, who are at the height of their immunity, they do not have to quarantine if they're exposed. They can be tested. They need to wear a mask for 10 days. They can be tested at day 5. For folks who may have been fully vaccinated but not boosted yet and they're due for a booster, they just haven't gotten it yet, they need to quarantine for 5 days. They can come back after 5 days if they do not have symptoms, as long as they wear a mask for another 5 days, and there's an option to test at day 5. Okay, can be tricky. I think a lot of us heard, oh good, we can shorten our vaccination, or excuse me, our isolation period to 5 days, but there are some caveats there, right? And there are also some details around quarantining. All right, let me stop sharing my screen for just a moment so I can talk to you about some other updates that have come through. Let's talk about testing. So this is obviously the most common question we get. And most of the time we're being asked, how can I get my employees tested? And we recognize, everyone recognizes that testing is difficult to get these days. We just simply don't have enough tests for the number of people who either have symptoms because Omicron spread so quickly and because it's respiratory season, or have been exposed because so many people have Omicron now. So we get that. I'm going to talk to you a little bit about how to maneuver through that. But before I do, let me just back up and describe the two basic types of testing, which I've done before, but I think it bears repeating. So we have antigen testing, which is usually that rapid test. So rapid antigen testing. This is really best used for folks who have symptoms. If you use a rapid antigen test on someone who doesn't have symptoms, who maybe had an exposure and is just concerned whether or not they've got COVID, it's sometimes going to come back positive when that person doesn't really have an infection. And you will need to confirm it with the other type of test, which is called a PCR test, or sometimes a nucleic acid amplification test, or NAAT test. Those are all the same. They're all equivalent. They have better accuracy. They're certainly the gold standard. It's the type of test that we use at Prisma Health for the most part. The downside is the turnaround time tends to be a lot longer. Okay, these are not those rapid tests. There are a couple, but they're expensive and they're hard to come by. These tests can be used really for any scenario, and we trust the results. So that's important when you're thinking about how to manage this. The rapid antigen tests are everywhere, and sometimes that's just the best we have. So if someone is exposed, maybe they don't have symptoms, and that's what they need to do, they need to get that test, that's great. But just understand that if it's positive, you might have someone who's out of the workforce for 5 days when that's actually a false positive, okay? Where can folks get tested? Let me tell you where they shouldn't get tested. Please do not send people to the emergency departments across our state. At Prisma Health, if you are coming for routine testing, say following an exposure or for travel or something like that, you will be sent to another testing site. Okay, we have to use the emergency rooms for emergencies. So please don't send folks there for testing at all, would be great, and certainly not for routine testing. The urgent cares are also going to be a difficult place to get tested if you're talking about routine testing, right? Certainly if someone is symptomatic, that's an appropriate place to go to be evaluated. Other places to go if you are sick are potentially your primary care office or ambulatory settings, but they are also being overwhelmed. So again, those are the places you want to go if you have a relationship, if you're an established patient, if you're not feeling well, please don't go there for routine testing. All right, where can you go? DHEC is opening more and more and more testing sites. The state understands that we need more testing, and DHEC is our public health agency. So go to their site, find a testing location, click on it, click on that button, and you will see where testing locations are. I know that it can be frustrating. There may be long lines. There may be long turnaround times to get the test back. So we're going to talk about what to do when someone's test is taking a while to come back. But those are really the best options for testing for folks. Certainly pharmacies are doing it as well. You're seeing that they're also getting booked up. So you may have to wait a day or 2 or 3 before you even get a test. While you're waiting, please quarantine. Okay, please, because the likelihood that your respiratory symptoms are COVID is incredibly high. And if you're not quarantining or you're not encouraging your workforce to quarantine, then you're going to be spreading it. The home tests, let's talk about home tests for a second, because I get a lot of questions about that. These are rapid antigen tests. So in symptomatic folks, they're going to be pretty darn reliable. I will tell you that you have to develop your policies on whether you will accept home tests. There are some that use an app to result the test, and that information is then date and time stamped and sent to public health agencies in the state that you're in. And so you may decide you trust that. For folks who are asymptomatic, who don't have symptoms, this rapid antigen test may turn out to be positive and be a false positive. But these can be good tests if you weave them into your policies responsibly. And that's where we can help. Please reach out to us if you're wondering about home tests, wondering how to use them. Do I need to proctor them? What's the best use for them? How do I track? That's what we're here for, to help counsel you on. Let's see. I will tell you, just share with you for information's sake, that Prisma Health's policy is to accept positive home tests. If someone feels sick and they do a home test, we honor that. However, if they have a negative home test, we do need that to be confirmed by a test done by a provider or a real retail site or a DHEC site to make sure that that is truly a negative. What do you do if you've got a team member who is sick, goes to get testing, any of these places, and the test is taking so long to come back that by the time their 5-day period of isolation would be up if they were positive, they haven't received their test yet. So what do you do in that case? Why don't you presume it's positive? Okay. If they are feeling better and they have not had a fever in the last 24 hours, then allow that employee to come back and mask for 5 days following. Okay. I know that's frustrating. I know you'd rather know. I know the employee would rather know. But follow the guidelines as if the person had tested positive until you get that result back, because you are going to come across this scenario where by the time someone gets their results, negative or positive, they're past that 5-day quarantine mark, or excuse me, isolation mark. So just treat them as if they are COVID positive, follow the guidelines. They're feeling better. They don't have a fever for 24 hours. They can come back to work and they can wear a mask for the next 5 days. Here's what you don't do. There is no recommendation, and by the way, there never has been any recommendation in the last 2 years to test someone to allow them to return to work. Okay, you're going to find, especially with PCR testing, but with both types of tests, that so soon after someone has gotten over a COVID infection, their test is going to remain positive. And so that's not going to help you. You need to use the clinical criteria of no fever and improved symptoms to bring them back. Do not test them for a return to work clearance. It is not in your best interest in terms of the way the tests work and the epidemiology and the pathophysiology of this virus, but it also depletes our testing resources for no reason. Okay, so I'm going to say it again. There is no recommendation for return to work testing for folks who are COVID positive. Now, there is a recommendation for optional testing at day 5 for folks who have been exposed to COVID, but there's no return to work recommendation for folks who are COVID positive. So don't have them do it. They don't need to test. And if they come to many of the testing lines that are around the state, they're going to be turned away because we know these recommendations and we know they don't need a test to return to work. And please pass that on to your colleagues. It will save you a lot of time because it's taking time to get the test back in the first place. It might be a false positive or a persistent positive and keep that person out of work. It's in your best interest, actually, not to require return to work testing for COVID positive folks. All right. Last thing I want to mention about testing is related to treatment. You may have been hearing a lot about some very interesting FDA, EUA approved therapies for COVID, okay, to keep folks who have mild or moderate disease and who may be at risk, such as our pregnant patients, our elderly patients, our immunocompromised patients, out of the hospital. And you may have some of those folks on your workforce. The key, though, to these therapies is that they have to be given early in the disease. So if you've got folks that you know could benefit from this kind of treatment, or you know that you have a pocket of population among your workforce that may fall into those higher risk categories, please communicate to them. Getting tested as soon as they become symptomatic is so important because the therapy cannot be given without a confirmed positive COVID test. Okay, they can't just present and say, oh, I don't feel well, I think it's COVID. They have to have that COVID test. There are 2 IV or intravenous therapies. One is a monoclonal antibody, the other is an antiviral. And then there are 2 oral, by mouth pills, any virals that can be effective as well. The supply is phenomenally limited, which is why we're really focusing on folks who are at high risk. But again, getting that medication in that person as soon as possible is the key. So reiterate again, if you're feeling bad, stay home, go get tested. Couple of vaccine updates and then we'll wrap up. Some good news. Again, right now the terminology fully vaccinated applies to folks who've had 2 mRNA vaccine doses or 1 Johnson & Johnson vaccine dose, boosted, or sometimes you'll hear it referred to as optimal immunity, is when someone has had a 3rd shot. For Pfizer now, the recommendation is that those folks can get their booster 5 months after their 2nd vaccine series shot instead of 6 months. Moderna is still 6 months. So if you started with Moderna, you're going to want to wait 6 months before you get your booster. And Johnson & Johnson is also still 2 months. There's also something called a 3rd shot. This is given way before that 2-month, 5-month, or 6-month mark. It's given at about 4 weeks after the last vaccine in a series. And this is for our immunocompromised folks. And what's changed here is that we can now give this 3rd dose to children ages 5 years old and up. We had not been able to do that before. I forgot to mention that there's also great news that our children 12 years old and up can now get boosted. Back in mid-December, they added 16 and 17-year-olds, and now as of this week, actually yesterday, January 6th, the CDC has approved that 12 to 15-year-olds can also get their booster, and many of them are due. So go out and get those kiddos their booster shot. The other big news that's happening today, remember this is January 7th, so by the time you see this, it will have been several days, and we will probably not have an answer, but it'll be interesting to see what considerations are being made, because arguments are being heard at the U.S. Supreme Court level around the ETSs for CMS and OSHA. Concerning vaccination of healthcare workers and vaccination and testing options for others in our workplaces. So that's happening tonight, and we will wait with bated breath to find out what's going to happen there. Obviously, if we are required to do surveillance, what's called surveillance testing, not exposure testing or diagnostic testing, but surveillance testing for the 50% of our South Carolinians who are not vaccinated on a weekly basis, that's going to be a huge outlay of resources. What our department is prepared to help you with is to consult with you to find out how you manage the ETS recommendations. What are the options out there? We can help you vet products if you're interested in testing on your site or interested in home test options. We can also provide you with train the trainer sessions if you all decide to do proctoring of home tests so that you feel comfortable with your processes in managing that. But we will all wait and see what happens from the U.S. Supreme Court and what that's going to mean for all of us out there. I do want to say one last thing before we wrap up. When you're talking with your workforce about these new isolation and quarantine and testing guidelines, understand that schools and healthcare workers may have different sets of rules. So if you're seeing different procedures being followed, different numbers of days, for instance, some districts in the state, school districts in the state are requiring a 10-day quarantine for kiddos as opposed to a 5-day quarantine for adults in other venues. Healthcare workers may not have to quarantine at all who've been exposed because of the contingency plans they have due to the crisis in our healthcare system, because so many people are sick and utilizing the healthcare system. Don't be surprised by that either. However, if you are confused because you are getting mixed information or you're seeing different kinds of guidelines being used for different folks, please reach out to us. I'm going to share with you our website and the phone number where you can reach us. Here we are at Creating a Safer Workplace. You can watch all of these videos. You can call us. Happy to do consultations to help you walk through what can be pretty complicated. Let's all keep our fingers crossed that this surge is quick and that, hey, maybe even it's the last one. Who knows? Happy to help you all. Remember, we're here to take care of you so you can take care of your workforce, and I'll see you in a month.